Hi, everybody. My name is Jessie. I'm a Canadian counselor, and I'm really hoping to open dialogue around mental health, around accessing counseling, and also around cultural competency with some of the participants that I interview. So today I have the honor of interviewing Morgan. She works in healthcare. I'll let her introduce.
I am a uncertified peer specialist. I am doing on-the-job training to
Mhm.
reach my certification. I'll tell you the story about how I got into what I'm doing. I've been in EMS and public service for 10 years of my life. And about a year ago, my EMS partner is a Desert Storm veteran.
Okay.
And he would tell me about these group therapy sessions that he would go to.
Mhm.
And he'd talk about this group therapy moderator is what he called her. And he would tell me about some of the things she does. And I'm like, I could do that. I would be really good at that job. And
Right.
so I sat here and I Googled, what does that mean? What is a group therapy moderator? And I came
Mhm.
across a certified peer specialist. And the qualifications to become a certified peer specialist is having real life experience as to what it's like to be stigmatized, to have a diagnosis, to have people treat you differently, to go through the steps of being inpatient and doing outpatient care.
Mhm.
I've lived that. And so people relate to me a little bit better when they also feel stigmatized and they also
Mhm.
feel like
Mhm.
people don't understand where they're coming from. And sitting in front of somebody who, is comparing you to a textbook sometimes is almost insulting.
Mhm.
Um, so the people that I work with are just like me, and they're trying to learn to master these skills that I have mastered.
Mhm.
Um, so I Googled, what that meant, and I put in for it. And by the graces of the something above, I was chosen to do this job. And I have loved every bit of it. It has been fascinating. And,
Mhm.
I work with people with a diagnosis of schizophrenia, bipolar, people who um, are depressed, like who have depression like I do, people who deal with anxiety. I deal with a whole plethora of mental health diagnoses.
Uh,
I also have experience with substance abuse. I myself am diagnosed as a major depressive with anxiety. I have mild OCD. I have acute PTSD, and I have experience with substance abuse. So I can relate to a lot of different people.
mhm.
Um,
Ye
so that's essentially what I do.
Yeah.
Um, some people would call it a type of form of group therapy.
Okay.
So
Yeah, and group therapy can be very helpful in different stages of our healing because we can connect with people that have experienced and you're there with that experience. So I actually have a question around the whole diagnosis versus, when we talk about PTSD and people that have gone through trauma. So I work with trauma a lot,
Mhm.
and I don't really like the diagnostic model because of course we have anxiety. Of course, we have nightmares. Our brain's trying to reprocess what has just happened. So, my question is, what are your thoughts on the whole diagnostic model, like putting that disorder on people? In which ways is it helpful? In which ways is it maybe not so helpful?
I would start with the stigmatization of it.
Mhm.
A lot of people, when they hear the word or when they hear the acronym PTSD, they think of only veterans. They
Mhm.
think of only people who have seen combat. They don't necessarily think about people who are sexual assault survivors. They don't think about people who have had a lot of trauma happen in a short period of time, such as myself.
Mhm.
Um, People don't. It's that stigma, and in the same time, I feel like PTSD is also inclusive in depression and anxiety.
Mhm.
So I feel like adding PTSD to someone who has depression and anxiety lengthens their diagnosis. And sometimes that can really bother people
Yeah.
because it's like, not only am I already being stigmatized because I'm depressive and I have anxious episodes, but now I'm like, do I really have to compare myself to a combat veteran? And
Okay.
like some people don't see that as fair because it's like, well, I don't think I had it as bad as this person. But the thing is that everybody deals with trauma differently. And comparing our trauma to someone else,
Mhm.
um, I'm guilty of it. I'm guilty of it myself. I sit here and, my partner that motivated me to to do this career.
Mhm.
I compare my traumas to his traumas, and I feel like there's no comparison. But at the same time, he's sitting here telling me I couldn't have dealt with what you did.
Yeah.
And I'm like, likewise, I
Mhm.
couldn't, have dealt with what you did. Um, so I feel like the diagnosis of PTSD is very broad,
Mhm.
and a lot of people maybe don't quite understand that. So,
Mhm. Mhm. Yeah, so in some ways, because PTSD already has this stigma of war veterans, and it still does now, even though sexual traumas, even attachment traumas, like the
mhm.
case of your attachment figure constantly rejecting you, that's a trauma.
Yeah.
So trauma can mean a lot of things, and what you're speaking of then is how sometimes that comparison model, and really, yeah, I remember my psychologist, so I've sat in the client seat for years as well, and
Yeah.
I have my own trauma, and he said to me, it's like apples and oranges. You can't take somebody who's been to war and then sexual trauma or whatever and compare it. It's just completely different, and it really is. Okay, so I can hear the story of what led you into doing the work that you do, and the passion really shines through when you speak as well. So maybe you could speak to what helped you access mental health support when you did.
Um, Speaking from myself and my own experience, I am one of those that it was forced upon me. I
Oh.
had this superwoman complex, and I stigmatized people just like people stigmatized me. And whenever I was going through it, I'm just like, you know what? I got this. I don't need help. I'm fine. Just leave me alone. It's not as bad as it looks. I promise you, it's not as bad as it looks. But then you wrap in self-destructive behavior, and
Mhm.
then you don't see what other people are seeing. And it's one of the things that did it for me was, people are sitting there and they're like, oh, I care about you and I don't want to see you go through this. And I'm like, well, let me show you how much you don't care.
Mhm.
And I've attempted suicide, and having attempted, um the decision was made for me. I remember, do you mind if I elaborate on
No,
that?
we can talk
Okay.
about we,
Throughout what I call my spiral, I was in therapy.
uh-huh.
I was in therapy from start to finish. And it's almost like my therapist, hearing all these consecutive things happen, kind of, she knew that I was a ticking time bomb.
Uh-huh.
And so, I remember that I just had one more incident, and that was just the cherry on top for me. And I had my suicide attempt. And I remember the next day I walked into work in full uniform, acting like nothing happened. And I was just like, I'm fine. Whatever it is that I told you yesterday, it was a lie. It didn't happen. Don't worry about it. And they knew that I was lying.
Mhm.
And so they're like, you need to take some time off and really really get yourself together. And I remember walking into my mental health evaluation,
Uh-huh.
and I walked in there and I talked for an hour and a half in uniform.
Uh-huh.
And once I got done talking, they asked me what I felt, and I said nothing. I feel nothing. And at that point, they were like, there's no doctor who wants to risk his license to let you leave this facility right now. And
Mhm.
I was just like, say what now?
Mhm.
And
Mhm.
it was one of those things where the decision was made for me. And whenever that decision was made for me, I'm like, this is bad. This is really bad.
Wow.
Um, because, I think about people who are depressed and really going through it. And I'm just like, my life isn't that bad. Someone else has it worse.
Mhm.
It's no big deal. And then all of a sudden, I'm locked up in an inpatient facility. And I'm like, man, my life has really spiraled.
Yeah, so you said you were feeling nothing, and you had just completely kind of desensitized from it and maybe dissociated, and you were
Mhm.
just in that hyper arousal where you were protecting yourself by being numb.
Mhm.
Hmm.
I
And
had nothing else to give.
yeah. And when you speak of how you accessed it, it really brings up for me. I have worked for the crisis lines in the Fraser Health region that I live in, and all of BC, some of their lines as well. And often as a clinician, I'm in this clinical decision making position where I know that the person calling in has had trauma because
You could
I've
sense.
talked to them or whatnot. We know that they've had trauma, and I'm in this position. Do I call emergency services and get them put into the psychiatric ward, or does that take away their power because they've been powerless in the face of trauma so many times? They've checked themselves in so many times, and now having the officers come take them in when they're so I'm in this conflicted position, and I don't know what the right answer is. And yeah, so for you, you found it helpful to go in.
Yes.
Mhm.
I'm glad that you brought that up because I'm really passionate about that as an EMT myself.
Yeah.
Um, I'm actually working with my place of work to create a policy, to create some kind of awareness that um, I get that every situation is different. Please hear me when I say that.
Mhm.
But as someone like me, being an EMT and having to be put in an ambulance and sent to an inpatient facility, um, and then where I work, a lot of times we have to have the police come in,
Mhm.
and the police are transporting people from our outpatient facility to an inpatient facility, and there's that stigma of being in trouble, and like there's that visual traumatization of somebody who has walked in and advocated for themselves and wanted help, but then we're punishing them by that visual of putting them in a police car.
Mhm.
And if we're trying to break that stigma between mental health and medical health,
Mhm.
and how we want people to understand that, you know, you can't take care of your physical health unless your mental health is taken care of first. Um, Whenever we think of someone who's had a heart attack or they've broken a leg or whatever, we think about an ambulance. But why? I don't understand why we need to have the police come.
Mhm.
And you know, some, I get that whenever people are, you know, where they're having a psychotic episode and they're violent and stuff like that, that's not what I'm that's not that's a completely different thing. But when someone like me has come in advocating for themselves, I don't feel that it's necessary to transport someone in a police car,
Mhm.
because that to me is sending the message that they're in trouble for asking for help. And you know, I'm very passionate about that. And a
Mhm.
lot of people don't know that there's a lot of private ambulance services that are not government run, that are more than qualified to transport someone who's in crisis. And for where I work, they didn't know that.
Okay.
So they would use, you know, the county or the city vehicles tying up, you know, the public service,
Mhm.
when you have the private service that's a little bit more discreet. They're more than qualified. They're usually, you know, they a lot of times they have openings of, you know, people who can respond to that. And instead of tying up a 24-hour service that, you know, responds to cardiac arrests and
Mhm.
um, you know, car accidents and stuff like that, you have this private service who does, like, that's what they do, is transports.
Yes. So when you bring that up, I'm in a different area. I'm in Canada. What
Yeah.
state are you in?
I am in Georgia of the United States. So
Okay,
I'm
so
from
our
the South.
viewers know that. Yes, okay, so you're in the States. So you can check in then for private services in the
Yes.
States if you're watching and you're in this position as well. And for those folks in Canada that are maybe in the BC region, I do want to point out in the Fraser Health region, we have something called CAR 67. So
Hmm.
psychiatric nurse comes with the police officer, and the police officers get notified that this is a mental health concern, so they don't come like in
Hmm.
the way that they would come if it was a different concern. However, they'll do have this fear if the person does have any weapons, or so all of that is stuff that's discussed as well. But if you're in the Richmond and coastal health region, there's CAR 87. So just if anyone's listening, there are some different services. So trying to figure that out and negotiate it before we make the call and have
And for
awareness. Yeah.
I'm not sure about Canada, but I know here in the United States we have what's called the crisis intervention teams.
Mm.
And typically we have what we call CIT officers, both at the EMS level and the police level.
Okay.
And I believe it's a requirement for a lot of services to provide a CIT officer. I am one of them. um, whenever you call for someone who is suicidal or whatever, you can request for a CIT officer, someone who's trained to talk to someone who's in a mental health episode. It's almost like a negotiator, where they sit down and they will talk to these people. And a lot of times these people just want to be heard. They don't want to incite violence. They don't want to, have attention drawn to themselves necessarily, but they want to be heard. They want someone to listen to them. But then at the same time, they need that help. And sometimes they know that they need that help. They just have no other way of expressing that other than to come in and be like, I'm suicidal and I don't know what I'm going to do.
So yeah, here we have the crisis. We have 1-800-SUICIDE, we have 310 mental health, and we have the crisis lines, and then we can access services and assess risk. So that's the piece that I've worked with for years and years, even through grad school. Yeah, so I really appreciate hearing all of your experience with your own, and it was very courageous of you to talk about your own access to mental health care. And
Yeah.
before that, so if we maybe, and only share again what you're comfortable sharing, but before that, what was the hindering? We kind of talked something about some of the stigma, but was there anything else that hindered you from wanting to access, like counseling, for instance?
Um, I think it was the not realizing what all was going on. Um, I started my counseling actually to get help for my marriage. And, I was going through a rough patch between me and my husband, and I'm just like, you know what? We just need to start seeking therapy or something. Or, I don't know what's going to fix this, but at least we got to try it. So, of course, we started the therapy. And then it was no sooner that we started seeking therapy that everything happened and spiraled out of control. Um, you know, I'll give you a little bit of a timeline so you can kind of understand what was going on at the time.
Okay.
So the first week of 2016, I think it was January 7th of 2016, I found out that my dad had stage 4 kidney cancer. And in that same night, I was standing next to my dad's hospital bed, and a buddy of mine from the fire department, his brother came in and had been murdered by someone that I went to high school with. And so I'm sitting there watching all this unfold in the trauma bay right next to my dad, who had just been diagnosed with cancer the exact same night. And then a few weeks later, I had a former teacher of mine and a former volleyball teammate commit suicide. And it was just a spiral. It was like there wasn't a month through 2016 where someone in my life, past or present, had died.
Yes, that's so, yes, so shocking to the system.
Yes. I
Yes.
just every month there was someone else that died. And by the time September came around, my dad had his tumor removal surgery, and it wasn't to cure him, it was just to kind of give him some more time. And my dad went in that operating room as the dad that I had known for, at that time, 25 years, and he came out like a monster in his shell. And it completely changed the dynamics of me and my family. Well, then my mother-in-law suddenly died from a heart attack 2 weeks later. So we're getting into October, and keep in mind, I'm pregnant at the time.
Oh,
And
so
yeah,
during pregnancy, this is when all of this is
yes,
happening. So you'll also have all of those hormones and all these
yes,
traumas and the grief. Okay, so
yes.
much.
So then at this point, we're talking October, and we bought a house and moved to a completely different area of Georgia. And, buying a house, for people who have done it, it's not an easy process. It is very lengthy, and it is very stressful. And then my father-in-law, he was in and out of the hospital as well, along with my dad. So you got all that. And then, here it is February of 2017, and I have my baby prematurely because of all the stress that I've been under.
Yeah.
And, I was not, I don't feel like I was heard during the postpartum stage, because I knew that something was wrong. But unfortunately, the healthcare that I was receiving, they weren't necessarily trained on how to really spot postpartum depression. And I got my diagnosis while I was still pregnant. So you add my diagnosis of dealing with depression in real life happening
Mhm.
to postpartum hormones,
Mhm.
and it's just a complete meltdown.
Mhm.
And then I struggled with infidelity issues
Mhm.
as a form of self-destructive behavior. And
Mhm.
so by May, Mother's Day of 2017 was the day that I attempted suicide. And that forever changed me. Um, and once I got out of the mental hospital, I was there for 6 days. And I got on antidepressants and all that stuff, but then I found solace in substances.
Uh-huh.
And I went through, substance abuse for about a year.
There's so much pain. You're trying to distance yourself from all of
Yeah.
this pain.
And so it's all just a spiral. That's all I can think about when I think about that time that I spent with all those scenarios happening to me all within a year's time frame, a year and a half max. That's almost unheard of for someone being 26 years old.
Huh.
Some people don't experience that amount of trauma in that short period of time until they're in their 40s.
Yeah. Or
And
maybe
so, or maybe ever. And
yeah.
so I'm sitting here and I'm 26 years old and I'm dealing with all this stuff and I'm just like, do I really need help? Or like, I didn't understand the severity of what was going on.
Mhm.
And so having been in therapy the whole time all of this is going on, but then having my healthcare, my doctor not understand what was really going on.
Mhm. Mhm.
And what baffled me is that they would have in my chart what all was going on with me, and they would constantly ask me, is this still going on? How are you holding up and all this stuff? And I'm like, I'm not. Like, what part of I can't sleep, I can't leave my house, I can't, do you not hear?
Yeah. So
And
I think you've brought up a few times, as humans, we have the need to be seen, to be heard, to be understood. But now we add trauma to that. And even in this shattered state that you're in, you're still not feeling seen or understood by any of your professional. But maybe they're doing the best they can, or whatnot. They're busy, but you weren't getting the care that you needed to start your healing journey.
mm-mm. And one last thing I'll speak on as far as that. For someone who has a job like I do, and I
Mhm.
speak all the time, and I've mastered being able to express myself in a way that most don't understand, I come across people who are like, oh, well, if you need anything, let me know. And I'll be honest with you, it's almost like bothersome for me,
Okay.
because I'm sitting here and I'm like, okay, what do I need right now? Well, I need somebody to work my job for me for about a week. I need someone to come do my dishes. I need someone to watch my kids for a weekend. That's what I need. But
Yeah.
a lot of times people are like, oh, well, if you just need to talk, honey, I am talked out. Like, if you want to help me, this is what's on my plate right now. if
Uh,
if you can help me with this, that is what would be helpful.
mm,
And at the same time, I'm very empathetic for some, being on the receiving end of that. I may not have anything else to offer but a listening ear. And please hear me when I say that is not wrong in any way, shape, or form, but that speaks on boundaries.
mhm,
you
mhm,
know for me, and having 3 children and having 2 jobs and all this stuff, the only thing that I can offer to someone right now is a listening ear. And
mhm,
that's not wrong,
mhm,
but that may not be what that person needs.
mm,
And if someone needs me to watch their kids for them, you know what, I'll get with you on a day for that whenever it works for both of us. And I'll help you with that. Um but a lot of people, they're not prepared to help someone who really needs help. And it's a love-hate thing, I'll be honest with you. It's
So
I
imagine
see
you're
both
talking about
sides.
family and friends here,
Yeah.
and then the boundaries that we have. And yes, okay. Yeah, so then for people maybe listening as well, if you're loved one is needing help, maybe offering, if you don't want to talk about it, can I babysit for you?
Yes. Cook
Maybe.
a meal,
Uh-huh.
run an errand for me,
Mhm.
go to the grocery store for me. Maybe that's what I need.
Mhm.
Maybe, sometimes depressive people, we isolate. And whenever we're isolating, we don't feel like talking. It is too exhausting to talk.
Mhm.
But it's also even more exhausting to not want to talk and then think about all the responsibilities that you have as an adult
Yeah.
and trying to keep your life together. And it's just like, it would be helpful to not have to run errands today. It would be helpful to not have to answer screaming kids. It would be helpful to not have to get up and be at work today. Self-care is not selfish.
Uh-huh. Absolutely. And when I talk to mothers, they're super women. Like, I don't understand how they do all of these
You
pieces.
know,
It's amazing, really. Okay, so now just to wrap up, maybe you could speak to those out there that are thinking about seeking help, may think that, things have happened and I'm not feeling like something's not sitting right. And earlier you spoke about the biggest piece, and I did research with participants through grad school. And in interviews, I found that the biggest piece is awareness that we actually need help before we can seek it. So,
Mhm.
what would you say to somebody who's scared, unsure, uncertain about seeking help?
Um, I would say taking the time to write out, even like just a bullet point list of what it is that's going on.
Mhm.
What is it that you want to speak about? And then create another list of what could help you, even if it sounds completely irrational. Write it down, what you think would help you. And I understand that people are very reluctant to make that first visit because they either are like, oh, I'll be all right, I don't really need this, or they'll be like, am I over exaggerating? Am I really, like, do I really need this? And my thing is like, it's not going to hurt you to do that one visit. Just do one,
Mhm.
and then see how you feel, or even give it maybe 3 sessions. Try to break it down a little bit and see if you can at least feel some kind of feedback towards listening to someone relate to you or help you understand why you feel the way you do. A lot of things that I had to go over in my own therapy is talking about my childhood. you know um I didn't consider my childhood to be really traumatic until I really had to break down why I am the way I am and why I'm reacting to life events the way I'm reacting to them. And it's mind-boggling when you sit here and you compare all the things that you went through as an adolescent to how you are as an adult. And me still being in my 20s, it's almost like it meshes together.
Mhm.
And but to me, um, for people who think that they're being irrational, um, maybe you're not being irrational. Maybe you just don't understand how to fully express what it is that you're feeling. And the only way I feel that you can really do that is by seeking a third party, which would be a therapist or a counselor or somebody, because for someone who's a third party, they can better understand where you're coming from. It's helpful to speak to family and friends, but they're a little biased. They are, whether they'll admit it or not, they're a little biased. And so it's almost like a fresh canvas.
Mhm.
You really get out what's on your mind to someone who can kind of ask you those nitpicky questions of like, why exactly do you feel that way?
Mhm.
Well, I don't know. Well, I hear that you feel this way about this and you feel this way about that. Would it be correct in saying that you feel this way because of this? And
Uh-huh.
some people don't, a lot of times they don't really think that deeply.
Mhm. Uh-huh. Okay, so just having somebody to help. And, as the client, you're the one that knows your experience and you're the one that's presenting what's going on for you. And then to have somebody support you in
Yes.
being able to understand yourself and then make the changes that you want to make.
Yes.
Hmm. and step back into your own power, because when we're dysregulated and we're getting up there in the anger and the anxiety, and we don't want to show up with our friends and family that way, and it's because of things that have happened to us, and being able to see where is it coming from, and then being able to self-soothe and self-regulate, tell people, "Oh, maybe I need to take half an hour when I start to get up there."
Yeah.
Hmm.
Another thing that I'd like to say is that for people who struggle with self-esteem issues, I am one of those as well. Um, I feel a sense of pride and I feel a sense of accomplishment being able to advocate for myself, in the sense that, you sit there in the therapist office and they may help you work your way around how you're feeling or be able to help you express those things. And
Hmm.
whenever you finally put together how it is that you're feeling, you can better understand it and feel confident that I'm feeling this way because of this, and I'm feeling this way because of that. And I feel like it speaks to someone's confidence to be able to understand why they feel the way they do. And some people don't think about that kind of thing. It is a sense of pride to be able to express how I feel.
Yeah, so like we're saying, stepping back into your power, it's empowerment
Hmm.
to be able to understand ourselves and then start showing up as the person that we want to be.
Hmm.
Hmm. Okay, so I'm glad that we had this chance to chat. There's so much rich information, and you have so much experience as well, you know, coming from your own experience. And it's so courageous to come on uh, live in public platform and speak about it. So I appreciate that you only shared what you felt comfortable sharing.
Oh, yeah.
Yeah, and then the work that you do within your community, maybe you want to tell us a little bit about projects and anything that you're really excited about. I can hear the passion you have in contributing to community. Yes.
Yes. I am actually currently putting together a project to encourage kindness. It's also a self-advocation project. I'm not sure if you've heard about the take what you need, leave what you can type projects, but that's what I'm working on.
It's
A lot of
familiar,
people
but I'm not sure.
So a lot of people that I work with, they're in unstable housing and or homeless. And what I mean by unstable is that some of these people live in motels, they live in short-term facilities, they live in shelters, and like I said, some of them are homeless. And when someone is going through it, it's almost dehumanizing for someone to have to ask for something like a book to read or hygiene products or food. And what I'm working on is creating a section in our facility where people can donate like non-perishables and those little hotel like shampoos and stuff that people like hoard and never use. Well, that would be helpful for somebody who can't afford to stay in a hotel or whatever. And I'm creating this area where people take what you need, leave what you can. And so people can go by and they can swipe, a thing of shampoo or, maybe some baby wipes or something. And they're advocating for themselves without feeling ashamed to have to ask for help.
Mhm.
It's a sense of pride to be able to find something that you need on your own. And at the same time, it deters stealing.
Yeah.
Some people will walk around a store and snatch up something that they need, my individuals included, sometimes. And it's like, if they can walk into my building and be like, well, I don't have to go steal something that's a necessity today,
Mhm.
it's offered to me. Um, I, that's something that I'm really passionate about because, sometimes I don't want to have to tell somebody that I need an extra stick of deodorant or something like that. Another thing, my husband is very active in our local church, and even my children um, pass out lunches and pass out food for people around here. I do live in a very impoverished area, um, and the area that I live in is very rural. A lot of people who have jobs that pay a little more actually commute to the metro Atlanta area. There's not a lot of big businesses around here. There's not a lot of really good money making opportunities here. And so for my children to be part of giving food to people who are less fortunate, to, give books to kids to read because they may not have them, School supplies. Our church provides school supplies for 2 county areas here. Passing out book bags and stuff like that, I feel instills gratitude for what they have, you know? So that's something that me and my entire family is passionate about. My husband's actually in school for his master's degree in pastoral counseling, so we're both kind of doing the counseling route. But we've lived through tragedy together. He's very well versed on being the recipient of someone with a mental health diagnosis. He's also the recipient of someone who's battled with infidelity issues. He's the recipient of grief. His mother died very tragically recently, and that's really taken a toll on him. So we have a plethora of things that we can both speak on, and we want to be able to implement that in our community.
Yes. Okay. So you're really giving back to the community. I can hear in both the projects that you're doing, and I hear, the gratitude and the excitement that comes from you, the energy when you speak about instilling these values in your children. And gratitude is also shown to like start shifting thought patterns. So
Mm-hmm.
we can live to have more happiness in our lives when we have that gratitude. So I'm really glad that I got this opportunity to chat with you, and you spoke about so much of your experience and how you've shifted that. You've taken your pains and you've really turned them into power in the way that you contribute to community.
Oh, well, thank you. I try. I really do. But I'm hoping that I mean, there's so much I can sit here and talk about. So, I mean, if there's anything else that you would like to chat about on another day, please reach out to me.
Okay. Okay. I really appreciate that, because